As a member of the Health Insurance Subcommittee, I'd like to rise to thank our co-chairs for really working hard to reach common ground. I want to thank Legislator Maisano, who played an important role in reaching a consensus. And I think the county executive deserves a lot of credit for also coming together with us to reach a common ground. When the proposition was floated by the county executive to have health insurance contributions, I think most legislators agreed that the time was ripe for that type of proposal to be made and implemented, because Westchester was only one of 4 counties that did not require health insurance contributions. Now, some may think it took a long road to get to where we are, but I think the process of having some robust debate and discussion to reach a consensus was, in the end, the right way to go. Many of us thought a 15% across the board proposal was not fair and equitable, so we played around with that, and we came up, particularly through Legislator Williams's initiative, with a 5-tier approach. The county executive favored a 3-tier approach, so we worked with him to come up with a 3-tier approach. And Legislator Maisano made some important suggestions to reach a compromise as to who would be included, because there was a question as to what employees would be included. So many people played a role in this, and I think almost every legislator participated and provided input. I'd like to point out 2 things that were not mentioned yet. One is, some may wonder why Westchester Community College is excluded, and the reason is that there's some case law in New York State by our highest court that suggests very strongly that we cannot dictate the compensation, how the compensation in the Westchester Community College and the benefits are parceled out. So we wanted to tread carefully and not do something that would provoke a court challenge. I also would point out one section of the law, proposed law, that has not been mentioned, and that is Section 6, which provides that the county can offer a health care insurance buyout of 50% of the premium rate, so that someone could be paid to get out of the plan and save the county money in that way. And I think that's an important part of the program, which I think, Mr. Chair, was your idea, as I recall. If I'm wrong, someone will correct me. And finally, I think we all look at this, as Legislator Williams suggested, as an interim measure as we look at the entire health insurance program that the county offers and all of the components of that program. And that's why I'm going to come back. I did not speak when the consultant proposal was presented, but I think that's why we need to move quickly. It's not premature to get a consultant in place to look at the health care program as a whole, because this solution is probably most likely an interim solution as we look for overall savings in the health plan with employee contributions as a component. But we really need to move forward and take a look at that plan as a whole.